Good afternoon, my name is Gina Garcia and today I'm going to talk about emphysematous cystitis. Definition is a rare entity characterized by pockets of gas in and around the bladder wall produced by bacterial or fungal fermentation. The presentation may be atypical and contrary to the degree of inflammation. Patients may present with subtle clinical findings. Patients may complain of irritative symptoms, abdominal discomfort, or pneumaturia.
Cystitis is a condition which results in constant urge to urinate and a burning sensation during urination. There is also pain in the lower abdomen and back. The urine passed by the patient is thick, dark in color and has a pungent smell. Sometimes the patient may pass blood or pus in the urine. Any infection in the urinary tract can lead to cystitis. Going for long stretches of time without urination leads to irritation in the bladder and can also cause this condition. Severe constipation, kidney or bladder stones, or enlargement of the prostate gland may also result in cystitis. Let us have a look at some home remedies which can provide relief in this condition. Boil a few drumsticks in water for 10 minutes. Strain the water, remove the drumsticks and peel its skin off. Crush it to make a paste. Place this paste on a sieve. Extract its juice. Consume this juice once daily and you will see an improvement in your condition. Take 1 cup of cucumber paste, place it on a sieve, extract its juice, add 1 teaspoon of honey, add 2 spoons of lemon juice, mix it well. Drink this thrice a day.
For more such natural home remedies.
Application in medicine. A 70-year-old woman with poorly controlled hyperlipidemia and diabetes present to the emergency department with a 5-day history of lower abdominal pain. She also had fever and reported nausea and vomiting. Physical examination revealed leukocytosis associated with a left shift and elevation of the levels of C-reactive protein and glucose. A plain radiograph of the kidneys, ureters, and bladder showed airs running the bladder. An abdominal computed tomographic scan revealed an area of gas dissecting the bladder wall. Bilateral hydronephrosis and intramural gas with a cobblestone or beaded necklace appearance. Findings consistent with emphysematous cystitis. Pros and cons. Pros. The radiographic findings provide the first and only diagnostic clue. Abdominopelvic CT scan further delineate the extent of disease. Cons. Emphysematous cystitis requires aggressive treatment with parenteral antibiotics and bladder drainage. Delayed diagnosis may lead to unfavorable outcomes, including overwhelming infections, extension to ureters, and renal parenchyma, bladder rupture, and death. Issues applied in Ecuador. Is a rare type of infection of the bladder wall by gas-forming bacteria or fungi. The most frequent offending organism is Escherichia coli and Klebsiella pneumoniae, associated with female sex, immunocompromised state, diabetes mellitus, previous recurrent urinary tract infections, urinary cystitis.
E. coli is a type of bacteria. It lives in your intestines and it lives in the intestines of animals. Most of the time, E. coli is harmless. You're not going to get sick. But there are some strains that can get you sick. E. coli 0157H7 is a particularly dangerous strain of E. coli. You can get it from undercooked ground meat. You can get it from vegetables, from unpasteurized milk and juice, from soft cheeses. While it is found in vegetables, ultimately an animal is the source. So animal waste somehow has come in contact with crops. Children and adults with weakened immune system, they're the most vulnerable to getting very sick. The signs of E. coli poisoning are nausea and vomiting, abdominal pain, cramps, fatigue, and fever. And if someone gets bloody diarrhea, that's a huge red flag that the infection has become severe. Most people who get sick from E. coli, they recover in 5 to 10 days. But some people, they get really sick. Their organs can shut down and they can die. There are things that you can do to prevent an E. coli infection. Wash your fruits and vegetables, cook your meats thoroughly, use a thermometer and get that thermometer up to 160 degrees. There's no cure for an E. coli infection. Antibiotics don't work, so the best that you can do is keep yourself hydrated and keep yourself rested.
Conclusion. The patient has treated with broad-spectrum antimicrobial agent and placement of a Foley catheter. Secondly, a urine culture was positive for Escherichia coli. The patient was treated with antibiotics and recovered uneventfully. Thank you.